My name is GuillermoChapa. I sell coffee for a living. I'm a Vietnam veteran. I'm 64 years old, and I pretty much always enjoyed good health. When I started having a couple of things that I needed to look at, I went to the VA clinic, and they treated me very well, and they started checking everything, and they found things that were wrong. One of the things that they found was an elevated PSA for my age. I got some good advice from some family doctors, some family members that are in the profession, specifically urologists, and they said you really need to check that. Don't let it go. I insisted, and I have to underline the fact that I had to insist to have a biopsy made. Well, I had a digital exam as a matter of course for the elevated PSA, which was not exaggerated, and I didn't have to have had it, but I said, what's next? I said, well, you could do this, you could do that. I said, okay, I want that. So they gave me the digital exam, and sure enough, they found a small mass. They touched a small mass. So I insisted, and again, I had to insist to have a biopsy done. They said pretty much, could be anything, could be nothing, and let's just wait and see. And I said, no, I want a biopsy. And I think that was the best thing that I ever did, because my biopsy were positive. I found to have some cancer cells. So then I continued to consult with those who know more than me and have had experiences, and they said, well, you need to have that removed. And when I brought this up to the doctors at VA, they were hesitant to really consider that as a really viable option at the beginning. And they said, the protocol nowadays is to wait and see, and this, they call it watchful waiting or something like that. And I said, no, I really think I need to have it removed. And they said, well, you're pretty young, and there's these consequences, and you really need to think about it. So I took some time to think about it, about 2 weeks over the holidays, and of course, in consultation with my wife and my family and my children, and then we decided, there's something wrong, take care of it. So I said, I want it removed. So they said, okay, you want it removed, we'll remove it, well, okay. And but it's really not necessary. And I said, well, it is, because you told me I had cancer cells in my prostate. I have a mass, so let's remove it. I was saying earlier that in Spanish we have saying, which is very, very adequate, I think, for this theme, that if you kill the dog, you eliminate the rabies. And I kind of had that analogy there with the rabies, and I wanted the rabies gone, so we killed the dog. We had it removed. The next step was to say, well, who was going to remove it? The VA said, who do you want removed? And I said, I don't know. So I did my research, and I found a lot of good doctors. There are a lot of good doctors, but little did I know that the best doctor was closest to me. I looked at the technical information, to the reviews and the statistics and all the things that people normally look at, but what really swayed me were the testimonials of other patients. To me, I put a lot of weight on that, and that's why I was really appreciative of having the opportunity to make this testimonial myself. Not so much for accolades to the doctor, which I'm sure he receives enough of those, but for the guys that are thinking about doing it, for the guys that aren't sure, for the guys that haven't even checked their prostate. That's step number one. And then dealing with it in a very, very serious way. Of course, you get the best of help, but you have to, meet the problem head on. You have to go on the offensive, and that's what I did. And when I found Dr. Kella, I said, this is the one. I want to go talk to him. So they gave me an appointment. When I called, it was like they already knew me, and then when I got in, it was like they already knew me. I met the doctor, and I was sold. I was sold. He looked at me straight in the eyes, told me exactly what I wanted to know, answered my questions directly and honestly and truthfully, very truthfully, and some of the answers were not easy to take, but, this could happen, this could happen, this could happen, this could happen. But the statistics show this, and this is what you can expect. And we went over and over and over and back and forth, and I made the decision. We set a date immediately. I came in, took care of it. When I first came in, I was wonderful facilities, wonderful hospital. My family, of course, was with me. We checked in, they prepped me. I met the staff, the surgical team. We went in. I said goodbye, I closed my eyes, I opened my eyes, I was in recovery. It took, it was a pretty textbook case. They removed it, it was a radical prostatectomy. They took it all out, and I was fine. I was out of the hospital the next afternoon, I was in the morning. Next evening I was out of the hospital, I was walking around all that day. I had some tiny little punctures and no pain to speak of. Other than the fact that somebody had actually cut me and been probing. But other than that, I started going to the men's room and urinating freely, and it's been a wonderful experience ever since. Wasn't sure what to expect, but I was ready for anything. I would recommend anybody who has any doubts or any questions, get with the staff, get with the team. You will have all your answers to all your questions, and do not hesitate for a second to meet this. It's a responsibility to have it taken care of for your family. I was fortunate in that I always had the philosophy already of not living necessarily for myself and not looking always inward. So I did. It was a difficult thing to do, but I brought it up to my children, who are adults, my wife, and we made the decision. It was a little scary, of course it was, but I knew, and I had been reassured, I'm not gonna die from this. But it was about the quality of life. 64 years old, you're gonna live with this thing about you've got cancer hanging over you, and what's it going to spread, what's it going to do. Just the symptoms alone of having the problem with the prostate were nothing to enjoy, nothing that you would want to wish on anybody. And unfortunately, I know that there's a lot of men that live with that, and they're scared to death of having, to know whether they have cancer or not. It's a very common thing for men, but there is a cure. There's a way to get beyond that and to take care of it and to have your life, to enjoy your life. Because I thought more about my granddaughter, more about my daughter, more about outside of myself, and it made sense. Was to me not the one who removed my prostate, but the one who took care of my cancer problem. My cancer was gone. As I reflect on the things that have transpired in the last 6 months, I just recently had my prostate removed. And, they would tell me, well, this could happen for 6 months, this could happen for a year, maybe after 2 years, this and that. And I'm here to tell you that, I'm way ahead of the game, because I really believe that it was the quality of the care that I had, and the intervention that I had, the whole intervention team. Of course, one's attitude is critical, one's support system, my wife, my children, and even something that many people don't put much attention to, but Dr. Kella's staff, for instance, we have become friends. They call me by name when I answer the phone. They know, hello, Mr. Chapa, how are you doing? It's good to hear you. I walk in, and they all come out, and hello, it's good to see you. Blah, blah. And what I thought was going to be very embarrassing moments, they turned out not to be, because they're so professional and so prepared, they're so knowledgeable, that I could ask any one of them any one of the questions, and they all know everything. They all know everything, and they're all very reassuring, very reassuring. I think that's critical. I think that is critical. It's not about going to a hospital and getting somebody to intervene in your body and to do a procedure. It's everything before that, it's everything, of course, during that, and it's everything after that. Again, I had alluded to the fact that, my own personal philosophy, as a Christian philosophy, really helps, because I know that, I don't need cancer to die, and, but it's about living while you're living. And as they say, I promise not to die until I die. And I don't plan to die anytime soon, especially not from this, thanks to Dr. Kella. I feel very confident. I feel very, very positive. It has affected me in a lot of ways that I had no idea that it would influence me so much. To know that I really made the right decision by choosing the procedure and by choosing him. I think that it made all the difference in my life, and hopefully the difference of those that I love and who love me.